Hello, everyone. Welcome to the 2021 ESRI User Conference. My name is Josh Thompson. I have served as a GIS manager with Peoria County, Illinois for over 8 years, providing GIS services and support for county departments and the community overall. This session will be on battling the opioid epidemic with ArcGIS Hub, which will discuss how the Tri-County area is using GIS to fight this crisis. Also presenting with us is Kyle Wickstrom. He's a solutions architect with ProWest and Associates. In the midst of the opioid epidemic, a Narcan advisory group was established among a group of community organizations in order to measure opioid use by tracking administrations of Narcan in the Tri-County area. The Tri-County area includes Peoria, Tazewell, and Woodford counties, which has a population of roughly 360,000. Community partners that play a role in Narcan distribution and administration were invited to participate. Each participating entity reports the number of Narcan administrations performed by their organizations each month to the Peoria County Health Department's Director of Epidemiology and Clinical Services, who leads the group. The director then compiles the data for analysis and presents the findings to the group during their monthly meeting. The group has been collaborating to engage more community partners who administer Narcan to develop an accurate picture of Narcan use in the Tri-County area. Over several years of compiling and analyzing the Narcan administration data, the group recognized the need for, number one, a website that could be used by both the general public and community partners for awareness and outreach. Number two, a website that centralized health services such as locating drug drop-off sites, locating treatment facilities, and participating organizations. Number three, a visual data analysis beyond graphs and charts, such as dashboards and locator web map applications. One big question someone might ask is, why did the county look to using GIS? It all started when the Peoria County Health Department was interested in several Esri platform GIS solutions from recent presentations and discussions that included ArcGIS Hub, dashboards, and web map applications for location analytics and storytelling. The health department knew this would be a great tool to help create a complete picture of the opioid crisis in the Tri-County area. The Peoria County Health Department and Peoria County GIS had an idea for the hub site, but needed additional help. ProWest and Associates helped prepare the data for simpler management by staff, develop and deploy a public information site, and provided training to key staff members on data and application management. The health department receives opioid data from several community organizations in different formats, which has made it difficult for them to format, visualize, and share the data with staff, partners, and citizens. They needed an ArcGIS hub site to bring together the fragmented information into a centralized set of focused applications, promoting opioid awareness and solutions to reduce opioid addiction. This site will also help to address the crisis through improved collaboration between organizations. The Narcan Advisory Group has been working to engage more community partners that are administering Narcan to develop an accurate picture of Narcan use in the Tri-County area. Through collaboration, the group hopes to provide public information on how to receive help with opioid addiction. If Narcan was not available for use in the Tri-County area, there'd be approximately 8 deaths per month due to overdoses. ProWest developed a plan for the Peoria County Health Department to help promote opioid awareness to the public and engage community organizations. ProWest used several of Esri solutions, which include ArcGIS Hub for the opioid awareness site, opioid response dashboard solution, opioid treatment locator solution, drug drop-off locator solution, pain management locator solution, and ArcGIS story map. An ArcGIS hub site was created as the opioid awareness website to centralize all information collected on the opioid crisis using the solutions selected in the plan. The hub site also had nice graphics and photos, contact information, and a link to the Peoria County Health Department Twitter site for real-time information. An opioid response dashboard was created on the hub site displaying total cases, successful reversals, repeated users, cardiac arrests, respiratory arrests, and Peoria Fire Department leave behind on a summary page. Time, age, gender, and race data for those receiving Narcan were displayed as graphs and charts on separate pages by year. Narcan administration data was also displayed in rate maps and also a rate change map. The opioid treatment locator solution is a treatment facilities application set up to be used by the public to locate drug treatment, mental health, and other health and human service providers in the community. The drug drop-off locator solution is an application set up for the public to locate facilities where unused prescription drugs can be safely disposed. The pain management locator solution is an application set up for the public to locate practitioners authorized to treat opioid dependency using buprenorphine treatments. Using an ArcGIS story map application, ProWest created a reporting organization story map application using for locating community partners that respond to opioid use cases in organizations reporting opioid treatments. ProWest met with Peoria County GIS and the Peoria County Health Department to review what was needed to start the project. Peoria County GIS had already met the GIS requirements for the project, which saved a lot of time. Esri Solutions acquired ArcGIS Online or ArcGIS Portal, ArcGIS Server, ArcGIS Desktop or ArcGIS Pro software, licensing, and optimal hardware. ArcGIS Desktop was used for publishing the map and feature services with ArcGIS Server. All the Esri solutions for the project were deployed to the Peoria County's ArcGIS Online portal. The published featured map services were added as items to ArcGIS Online. ArcGIS Hub Basic was deployed and configured on ArcGIS Online for the new Opioid Awareness Hub site. As a note, ArcGIS Hub Basic comes with the purchase of an ArcGIS Online subscription plan with no additional cost. ProWest then came up with a list of items needed from the Peoria County Health Department and Peoria County GIS for the project, which included public safety facilities, treatment facilities, controlled substance disposal sites, Narcan administration reports, and buprenorphine practitioners. The Peoria County Health Department provided the public safety facility location information. This is the address information of the community organizations that report on Narcan administrations. ProWest geocoded the address information to create an address point feature class of all the locations. The feature class was published and used in the reporting organization's story map application. The Peoria County Health Department provided the latest treatment facilities using an Excel spreadsheet, which contained the facility names and site addresses. Using the site addresses, the data was geocoded to create an address point feature class. And then the controlled substance disposal sites GIS dataset is used in the drug drop-off locator web map application. Updating the controlled substance disposal sites GIS dataset requires pulling data from the U.S. Department of Justice Diversion Control Division website and geocoding the addresses to create the initial site location data. The Peoria County Health Department receives monthly Narcan administration reports from community organizations by email in different formats. After receiving all of the data, the health department would have to reformat or clean up the data using Excel, and they would add it to a master Excel spreadsheet. Using the master Excel spreadsheet, ProWest was able to develop the geodatabase feature classes and tables for the project, and the buprenorphine practitioner data was downloaded from SAM HSA website in CSV file format. This process requires searching and downloading the data from the website. Once the data was downloaded, the formatting was cleaned up and the facility site addresses were geocoded to create an address point feature class. After all of the GIS data sets were created, ProWest published them as feature services. The feature services were added as items on ArcGIS Online, and these items were then added into web maps that would be consumed into the applications. Once the web maps were complete, the applications are deployed on ArcGIS Online and configured. Lastly, the applications were then referenced on the new Peoria County Opioid Awareness Hub site. And I'm going to go ahead and turn this over to Kyle, our other presenter, and he's going to describe more of the pre-configured solutions.
Thanks, Josh. So I want to talk a little bit about the implementation process that we worked with the county and the city on. When we got together with the city and the county to discuss what some of their needs were, we quickly identified Esri's Opioid Awareness Hub solution as one of the solutions that we could deploy for that organization. Using some of the data that they had provided to us, we worked to format that data in a way that could be consumed by the applications out of the box. And then there were some needs from some of the departments that required us to build out the capabilities of some of these solutions and configure some additional maps and additional applications. So we were able to use the pre-configured Esri solution for opioid awareness, make some modifications to the way some of those applications were configured, and then develop additional applications that could be used to display the data that the departments had in their possession. So remembering that these were pre-configured solutions, it was important for us to understand the stakeholders, not just the general public, but the department users and the GIS users, to help them understand how they can maintain and manage that data. We needed to understand those data management workflows to ensure that managing the content being used in the website was going to be efficient and effective. We built out some additional solutions to support some of the additional needs that the department had that went beyond what was available in the out-of-the-box solution. And working with the county and the city, we quickly identified that flexibility and openness to modifying workflows was going to be key to making sure that this project went through seamlessly and that it was maintainable into the future. So now I'm going to turn it back to Josh, and he's going to give us a walkthrough of the opioid awareness site.
If you go to the Peoria County website, we have a button called GIS Data and Maps. And if you click on that, they'll take you to our main GIS page, which is an open data website. And if you scroll down just a little ways here below our COVID-19 summary dashboard, we have a popular content section, and you'll see the opioid awareness hub site here. And when you click on it, it'll take you right to that site. And ProWest had helped put this all together for us, and it has a lot of nice factual information in here. It provides the health department's vision and their mission. And as you scroll down, it gives you some more details about opioid awareness. And then here, this is our dashboard that was put together. And it starts off right here at the opioid data summary, which shows you the total Narcan administrations, total repeat users, and total overdose mortality from years 2017 through 2020. And it also is broken out to some different tabs in the dashboard. So just briefly go through this. Overdose mortality summaries for the same year range. We also have time for Narcan administrations over time from years 2017 through 2020. And then we also have Narcan administrations by age as pie charts with a little graph at the bottom. And it's also broken down for gender and race. And then we also have some different maps broken out by year from 2017 to 2020 that will show you the visualization side of Narcan administration rates, and it shows cases per 1,000. And then we also have a Narcan administration rate change map from 2019 to 2020 that shows you if there's any decreases or no change that has occurred or increases. And then lastly on here, we have a breakout of repeat users summary by year from 2017 to 2020. And so as you scroll down past the dashboard, there's some other facts and really nice graphics. And as you get down closer to the bottom, we have 3 different locators shown here, where you can view pre-morphine practitioners, drug drop-off locations, and treatment facilities. So you can search any of these to get more information for those sites. And so I can do a brief example for treatment facilities. So this is what each locator application would look like. And it gives you a range of like a buffer range that you can choose from for the area that you search. So you can either search an address or you can click on the map and based off that point and your buffer, which is set to 4 miles right now, it'll pull all that data. It'll pull all the locations on the map in that 4-mile buffer radius. And so it lists all these locations and it starts off with the closest one. And it gives you the phone number, name of the facility, and it gives you the attribute data or all the information of their number of their beds and cost and things like that. And so that's just kind of a brief overview of that application. And as you scroll down near the bottom, we also have the Community Partners and Reporting Organizations app. This is the story map that we had talked about earlier. And if you click on that, this story map provides a nice web map, interactive web map on here, showing the locations of these organizations that report opioid treatment cases. And so you can zoom in and out on the map, or you can also click on that organization, it'll zoom right to it on the map for you. And then as we get down to the bottom of the site, ProWest also was able to add the health department's Twitter site. So that way the public can have real-time information and updates on everything that's going on with the health department. And then lastly, here at the bottom, we have contact information. If anyone wants to reach out to the health department, they can email them. So that's just a brief demo of what all is on our site. Since project implementation, the health department realized additional changes to the ArcGIS website dashboard were needed to improve the collaboration among community partners. And the opioid case summary page was recently updated to display the 2017 to 2020 total Narcan administrations, total repeat users, and total overdose mortality. We also added in there the overdose mortality summary with hyperlinks to the mortality reports, and that covered years 2017 to 2020. And the county is continually focusing on keeping the data up to date and providing a trusted source of information to the community. And with the data coming in from several agencies, the Peoria County GIS department is continually working with the health department to enhance its current workflow to develop a more straightforward automated process of bringing the data together in the hub, making it easier and more efficient to stay up to date with help for the public health and GIS staff to stay focused on the mission. So far, we have assisted the health department to change the formatting in their Excel spreadsheet to make it easier for exporting the data into a clean geodatabase table without having to adjust data types and attribute data. And also to move their Excel spreadsheet to a SharePoint site so Peoria County GIS staff can easily access the data for updating the opioid GIS data sets. In the past, we would get emails of the updates. It makes it so much easier to have SharePoint where you can easily just go in there and access the data when you need to. And then the Peoria County GIS department is also looking into how the Narcan administration reporting can be streamlined, such as using an online form that each community partner would submit rather than compiling files into one Excel spreadsheet. So that's something we're still currently looking into, and maybe here in the near future, we might do something like that. Well, thank you so much for attending our presentation. Please reach out to us for any questions. And we have our emails here if you need anything. And thank you so much.